decision about cervical triangle contents. The precision I explained about cervical triangle, anterior and posterior angle, and today I will explain about the cervical triangle contents. One of the structures located in the anterior cervical triangle is the ansa cervicalis. This is ansa cervicalis. As you see, is formed by first, second, and third cervical nerve, cervical spinal nerve. Actually, ansa cervicalis is formed by two roots, superior roots and inferior roots. Superior roots produced by the first cervical spinal nerve, but the inferior roots is formed by second and third cervical spinal nerves. Superior and inferior roots join together and forms ansa cervicalis. Ansa cervicalis innervates infrahyoid muscles, all of infrahyoid muscles except the thyrohyoid muscles. This is the schematic picture. Show the ansa cervicalis. The C1 forms the superior root of ansa cervicalis, and C2 and C3 forms the inferior root of ansa cervicalis. Ansa cervicalis innervated the sternohyoid muscles, sternothyroid muscles, and omohyoid muscles. The thyroid muscles are innervated directly by C1. Innervation of thyroid is similar to the geniohyoid muscles. It's not innervated by ansa cervicalis. This is ansa cervicalis, is located anterior wall of carotid sheath. Carotid sheath contain of internal jugular vein, carotid artery, and vagus nerve. This is the carotid sheath. Carotid. Ansa cervicalis is located anterior wall of carotid sheath and is related to component of carotid and sympathetic chain at the posterior. This is the C1 spinal nerve. In beginning of direction is accompanied with hypoglossal nerve. After the C1 nerves to thyrohyoid and the geniohyoid muscles and innervated these muscles. Carotid sheath is a connective tissue located around the jugular vein, common carotid artery, internal carotid artery, and vagus nerve. This is the carotid sheath. And lie around the main vessels and nerve in the neck. Sheath contains the common carotid artery, internal carotid artery, vagus nerve, and internal jugular vein. but the external carotid artery don't cover with the carotid sheath. This is the internal jugular vein, common carotid artery, and vagus nerve. These are component or content of carotid sheath. This is the ansa cervicalis, located anterior wall of carotid sheath. And please look at the position of vein, artery, and vagus. In carotid sheath, the internal jugular vein is placed laterally. Common carotid artery and internal carotid artery is placed medially, and the vagus nerve lies in between the vein and artery at the posterior. First, I explain common carotid artery. Left and common carotid artery have a different origination. Please look at this picture. This is the left common carotid artery, and this one is the right common carotid artery. Left common carotid artery raised directly from arch of aorta, but the right common carotid artery raised from brachiocephalic artery. This is the brachiocephalic artery. Actually, aortic arch has three branches: brachiocephalic artery, left common carotid artery, and left subclavian artery. At the right brachiocephalic artery, the sternoclavicular joint divided to right common carotid artery and right subclavian artery. So the origin of artery is left and right side. Common artery goes upward, and when it's near the superior part of cartilage, this is the thyroid cartilage. Near the thyroid cartilage is divided to internal and external carotid artery. Internal carotid artery has no branch in the neck and goes upward and finally enter the skull, and is located lateral to external carotid artery. But the external carotid artery in the neck has 6 branches. This one. Superior thyroid branch, ascending pharyngeal artery, lingual artery, facial artery, base, occipital artery, goes to posterior part of skull, posterior auricular artery, goes in the ear, and terminal branches of external carotid artery consist of superficial temporal artery and maxillary artery. Maxillary artery goes to infratemporal fossa, and superficial temporal artery goes to skull and temporal region. At the previous session, I explained about carotid triangle. This is the carotid triangle. This triangle is formed by SCM, sternocleidomastoid muscles, superior belly of infraomohyoid muscle, and posterior belly of digastric muscles. This is the carotid triangle. 5 types of external carotid artery are separated by the carotid triangle. Please name the 5 branches of external carotid raised from or separated from inside the carotid triangle. I wait for your answer. Ask you write or name the 5 branches of external carotid arteries separated from carotid triangle. If you activate microphone, it's better. Lobnar, right dual, facial, occipital, and maxillary. It's not right. Yes. Superior thyroid branch, lingual, facial, ascending pharyngeal, and occipital branch. Maxillary is wrong. So, superior thyroid branch, ascending pharyngeal branch, lingual branch, facial branch, and occipital branch separated from external carotid artery inside the carotid triangle. Is here. This is the superior thyroid artery. Is the first branch of external carotid artery raised from anterior surface of external carotid artery near bifurcation of common carotid artery. After that, the superior thyroid artery travel downward and enter the thyroid gland and supply the superior part of thyroid glands. The superior thyroid artery has a smaller branch as a superior laryngeal artery. This one. The superior artery passes from thyrohyoid membrane, this membrane, and enter the internal surface of larynx and supply the superior part of larynx. The superior thyroid artery enter the thyroid gland. Each superior thyroid artery at the anterior surface of thyroid gland anastomose with another superior thyroid and has a superior laryngeal branch, passes the thyrohyoid membrane and enter the internal surface larynx. Superior thyroid artery has another smaller branch as a infrahyoid branch. Infrahyoid branch supply the infrahyoid muscles such as sternohyoid, sternothyroid, omohyoid, and thyrohyoid muscles. The lingual artery raised from anterior surface of external carotid artery. After that, the lingual artery passes deeper to hyoid muscles, these muscles, and finally enter the oral cavity and divided to dorsal lingual branch, deep lingual branch, and sublingual branch. Lingual branch supply the sublingual salivary glands. This is the deep lingual, and dorsal lingual supply the different part of the tongue. The important point of the lingual artery is a lingual artery raised from external carotid artery near the greater horn of hyoid bone. Please look at this picture. This is the hyoid bone, and this one is lingual artery raised from external carotid artery near the greater horn of hyoid bone. It's a very, very important point. The facial artery raised from anterior surface of external carotid artery inside the carotid triangle. After that, goes toward the face and cross the inferior border of mandible, anterior to masseter muscles. After that, enter to face, and it's divided to inferior labial branch, divided to superior labial branch, and it has a nasal branch, goes to nose, and the last branch is the angular artery, goes to medial corner of eye, and anastomose with supratrochlear, supraorbital artery. Supratrochlear and supraorbital artery are branches of ophthalmic artery. The next session, I will explain about this artery. Okay, the facial artery has a facial branch and cervical branch. Facial branch include the inferior labial, superior labial, nasal, and angular artery. But the cervical branch consists of a tonsillar and ascending palatine branch, and consists of submental branch. This is the submental branch. This is the facial artery to the face, and this is the mental branch, goes to mental region. But the tonsillar and palatine branch goes to tonsil and soft palate. So this is very important. You should know about the facial and cervical branch of facial artery. I repeat branches. The facial artery consists of superior labial, nasal, and angular, but the cervical consists of tonsillar, ascending palate, and submental branch. This is the facial artery. This is the submental branch, raised from facial artery in the neck region, and this is the tonsillar and ascending branch goes to palatine tonsil and soft palate. And finally, the facial artery entered the face, divided to facial branch, such as inferior labial, superior labial, nasal branch, and angular branch. Okay. This is the ascending pharyngeal branch, raised from posterior surface of external carotid artery and travel upward and goes to pharynx and soft palate, apply the pharynx and palatine tonsil soft palate. This is the occipital branch, external carotid from the posterior surface external carotid and go to occipital region. It passes deeper to SCM and posterior belly of digastric. Finally, enter the occipital groove posterior to muscle process, and finally enter the posterior part of the skull and supply region. This is the posterior auricular artery, raised from posterior surface of external artery, and the final passes between external acoustic meatus and mastoid process and inside the region behind the ear. And finally, external carotid artery is divided to maxillary artery and superficial temporal artery. Superficial temporal artery goes and travels upward and enter to temporal artery. But the maxillary artery passes to posterior to ramus of mandible and infratemporal fossa, and it has several branches. And the next session explain about the branch of superficial temporal and maxillary artery. Okay. I ask you one question. Please write the name of artery raised from external carotid artery superior to posterior belly of digastric. Each artery raised from external carotid superior to posterior belly of digastric muscles. Look at the picture and no, it's wrong. Yes, Lubna, positive point for you. Posterior auricular. This is the posterior auricular artery raised from external carotid above or superior to posterior digastric muscle. This is the posterior belly and gastric muscles. But the occipital artery arises from external carotid inferior to posterior belly of digastric. This muscle is a landmark for separation of posterior auricular and occipital artery. It's very important. Do you have a question about external artery? Do you have a question about external carotid artery? No. This is the common carotid artery near the upper part of thyroid cartilage. Is divided to external and internal carotid branch. Internal carotid branch has a node branch in the neck, and it has a 4-part: cervical part, petrous part, cavernous part, and cerebral part, because it passes near the cavernous sinus, and after that, and finally enter the skull and divided 3 branch: middle cerebral branch, anterior cerebral branch, and ophthalmic artery. Middle and anterior cerebral and ophthalmic artery are cerebral part of internal carotid artery. Internal carotid artery in the neck has a branch. You know, it passes from carotid canal and enter the skull. Carotid and carotid sinus. Carotid is here. Is located near the bifurcation of common carotid artery. Is the oval structure, this one, and is a chemoreceptor, respond to change of oxygen and CO2 in the blood, and innervated by glossopharyngeal nerve, vagus nerve, and sympathetic nerve. But the carotid sinus enlargement is near initiation part of internal carotid artery. It's here. It's location of the sinus, and the carotid sinus is a receptor and respond to blood pressure. If the blood pressure is changed, carotid sinus send signal to medulla oblongata from the vagus nerve and glossopharyngeal nerve. There is another sinus as a aortic sinus in aortic arch, and this one is a baroreceptor similar to carotid sinus. Another component of carotid is the internal jugular vein. Internal jugular vein actually is a continuation of sigmoid sinus in the skull. After that, it passes from jugular foramen and enter the neck and enter the carotid sheath. Inferior part of the neck, the internal jugular vein joins to subclavian vein and form the